Hi, it's Sunday morning, and it's Alan and Andy talking about return to healing. And we're talking about a topic that Alan and I had a problem remembering what this topic was because we're old, right, Alan? We're getting
Ex
old. But
exactly. And that's now illegal in this country. So
it is illegal.
we might as well just hang up our stethoscopes because time is a done. It's like,
Well, yes. Yeah. I do find as I get old, it's funny. I feel like my humility is more, but also my confidence in what I do is more. And my
yeah,
confidence to say I don't know is more. All that becomes more. I stand on 2 feet when I tell people I have no idea what's going on with you.
right.
And they say,
Eh,
"What specialist should we go to?" And they say, "That I know, none." I
yeah.
said, "We'll figure it out together." But that reminds me of a story. I have and that's what kind of prompted this discussion today. I have a wonderful couple I take care of. They're probably in their early 70s, maybe mid 70s, and he worries about her becoming more forgetful. And she's not so worried. She has some anxiety that sometimes clouds her thinking. She has some chronic illness that might get in the way, but she's very functional. She just repeats herself sometimes. Cognitively, which means how our most important part of our brain works, our reasoning part. She's good. She goes to work, she drives, she does everything she needs to do. But he keeps pushing me for the last year. He's been pushing me. What's wrong with her? We did some basic tests. We even did a CAT scan, Alan, which I didn't think was that indicated, but everything was normal. Even worked on it. We worked on anxiety and things like that. But he wasn't good enough. So he found a memory expert at a university near me. And the memory expert, by the way, was a nurse practitioner. And she ordered a battery of tests that I looked up at least $10,000. And her focus was there's a thing called a PET scan, which you usually do when people have advanced cancer and you don't know if it's spread, or you're monitoring to see if the spread has gotten better with treatment. Expensive tests usually reserved for that. And then she also ordered a series of blood tests, pages of blood tests, most of which were to look for a protein called amyloid, which both cardiologists and neurologists are fixated on now, despite a complete lack of evidence that amyloid has any meaning. And I'll get back to amyloid maybe later in the conversation because it's really important. Well, anyway, she has amyloid in her blood. So her husband calls me and says, "Now we saw this. It says there's a high rate of Alzheimer's with this." He said, "What should we do next?" I said, "What you do next is up to you because I wouldn't have ordered those tests. I don't think there might be a correlation between amyloid and Alzheimer's, but I also know that tons of people without Alzheimer's have amyloid and tons of people with Alzheimer's don't have amyloid. And I know that treating amyloid, which has been done now, um, will lead to brain bleeds and disability, but not improved memory, nor are any studies long enough to show that it has any meaning that maybe amyloid's there to protect the brain. We don't know. We don't know why amyloid's there. Um, and he didn't like that answer. But I said, go back to your nurse practitioner, expert neurologist at the university and ask them what to do. I said, but beware because this is what the guy said to me when I told him this was not a good approach. He said, "You can never have too much information." So, Alan, here we go. This is the problem.
Well, we know, Andy, we know about the problem of over too much information, and that overtesting leads to overdiagnosis, it leads to overtreatment, and if it improved outcomes or something, you could understand it a little bit, but we know that it does not in most conditions, including dementia. And we have to deal with this every day, unfortunately. And when you started your conversation about what you know and what you don't know, I've always told my residents, the most important thing you could know as a doctor is to know what you don't know, and look it up, but don't look it up on an app. Look it up on real evidence, read an article, and come up with the conclusion for yourself, not what the other experts. And in this case, most of those experts are paid by I guess it's the American Alzheimer's Association for this, along with Big Pharma, because those are the two organizations that stand to benefit the most. out of overdiagnosing this condition.
And by the way, Alan, the American Alzheimer's Association, which does support this, is I think we have it in our book, but they're about 80% funded by the pharmaceutical industry. People think these organizations like the American Diabetes Association, American Cancer Society, American Alzheimer's Association are out there to help you and to guide you, but they're there so you could feel like you have a condition for which you need to take drugs, and you could watch actually the evolution of the American Alzheimer's Association. My friend and I, your ex-student, did that. We went through years of what they say. And as they got more drug money and as their leadership from their academic leadership were people doing studies for drug companies, their recommendations changed to be pharmaceutical. This testing that's being done is strictly to sell a drug that did not even pass the FDA first time around because the FDA said too dangerous and not enough evidence that it helps. And the neurologist said, well, we know theoretically it should help because amyloid, there's more amyloid in people with dementia. And meanwhile, Alan, there's something called, there's a bias called selection bias. Yeah, the most brains that are studied are people with dementia. Well, let's study a lot of brains of people who are 95 years old and pretty sharp, and let's see how much amyloid's in those brains. And there's probably a lot. It just builds up with age. And we could also speculate that it might be preventing brain bleeds because we know when we pull amyloid away, our brain bleeds. So, but this is not something that they consider. It is the treatment. The reason we're testing for amyloid, the only reason is because now they have a drug to treat amyloid. If there were no drug, we wouldn't be doing these tests. And
Sure.
somehow the doctors don't see this connect, nor do patients a lot of times realize that too much information is a bad thing. It leads us down a bad road. And I've always said, Alan, because I have neurologists in my town, I won't send people to them. All they do is put people on these drugs for dementia. Oh, you have dementia. Let's go on Aricept, Exelon, Namenda. We have all that stuff in our book. There's literally no evidence these drugs help anything more than placebo. Placebo does a pretty good job, I must
Yeah.
say.
Well, I have to admit, I don't start anyone on any of those
I
drugs,
never have either, Alan. Never,
and
zero.
and I get people coming to me and they ask me to renew them, and I was like, has it done anything to help? Well, I don't know. I don't think so. It's pretty much the same. So then why are you taking it? Like you're risking side effects and other issues for a drug that really has limited proof. But, I think the one thing to me, and I looked at this a lot when the drug, you know, these new class of drugs, which are the intravenous ones called monoclonal antibodies, which are being essentially used for every condition. It really says what's wrong with our healthcare system and how we do research. So the pharmaceutical company, essentially comes up with what they want to find, okay? And they're going to find a drug to treat what they want to find, whether it helps the condition or not. And I think it's Andy's favorite thing, surrogate endpoints,
Mhm.
and with this, it was what was the drug? Adulem?
It's something like that. I can't pronounce.
So the first drug, that was essentially released was barely released before it was pulled from the market because the pharmaceutical company realized once people actually started digging in and looking that it had no evidence for improving cognition in any of these people. It had no evidence actually for anything except amyloid. And as Andy said, there is no evidence that amyloid really makes a difference. So it's the perfect example of what we do. We create something, then we create a drug to treat that something, and then we spend billions of dollars for people not to live longer or better. That's the
And we,
summary.
yeah, and that's a surrogate endpoint is like when we talked about it with cholesterol as well, it's tying a number, a measurable number to an outcome. So now we can measure amyloid. So everything in our medical system is about measuring things. So a lot of my patients with dementia say, well, what tests are we going to do? I said, there are no tests. I said, I can tell you this. People who take drugs do the same regarding placebo. I've looked into this, and we have a big talk in the book and about this topic. If you actually do something called patient caregiver score, which means you're going to ask the patient or the people who know the patient best if they've improved
Mhm.
with some of these interventions. About 30% of people on the drugs say they improved, and about a 30% of people on placebo say they improved.
Exactly.
It's exactly the same. So the drug companies came up, and it took a lot of trial and error. You could look at decade of trial and error to come up with a 70 question test. And they found on this particular 70 question test that has stupid questions that if four questions improve on a drug, then that's considered a significant outcome. And it turns out in some of these drugs, 9% of people have a four question improvement compared to placebo. And that 9% dwindles to 0% by 1 year. At 1 year, every study ends. You take a look at them, they all ended a year. And so a friend of mine in NIH said, yeah, and this is when we were at Lown. She said, yeah, I've looked at these studies. After a year, people on placebo start doing better on the test. Now, first of all, the test is meaningless because caregiver score is the only thing we care about. Secondly, that these drugs improve 9% who answer four questions better is a meaningless outcome. Um, but thirdly, it looks like placebo is doing better even on that parameter after a year. But these drugs stay on forever, and no one gets better. They have side effects: Aricept/Exelon, weight loss, anorexia, which means you're not hungry. Sometimes agitation, some cardiac conditions. It's not free stuff you're getting. Um, and we have great stories in our book about
Yeah,
this, but it's very
and
frustrating.
yeah, it brings up the placebo effect. It's such an interesting thing because we know how well people do. And how the doctor presents it, like the placebo effect has been studied greatly. So if me or Andy go to the patient and say, we got this little yellow pill for you, and you're going to be sharp in, about a month, and it's got a really good side effect profile. Well, we know after that, a very high percentage, it's 30, maybe even higher, 50% could say, you know what, I think it is. I think I'm doing better. And some of them will get side effects too from
Right.
an inert pill.
Especially if you tell them what the side effects might
Oh,
be.
yes. Yes, it's very funny. So the power of suggestion of a physician, I'll tell you another time about a placebo thing that I did, or a side effect thing that I did early in the ACE inhibitor years. But it really shows that we could create any study we want. Not we wouldn't do that, but to get any result we want, so we could create a drug that we want to make a lot of money for our company. And that is the way healthcare works in this country. And I have to tell you, like it hit me on Thursday. We had a grand rounds in our program on pediatric vaccinations. And the whole controversy with RFK and this and that, and what's some of the evidence, before or against this, and how there's not a lot of evidence for a lot of things, but how, our country vaccinates a lot more than the rest of the world. And these people are so blinded, the young people, that, the CDC and all these people in the past said, I must give every single person every one of these vaccinations, and every adult must take RSV and shingles vaccine and this one and this one and this one. If you don't take it, you're going to die. They don't tell you you could get Guillain-Barré syndrome from a shingles vaccine and die. Like that, they don't, and they're so blinded. And now they're so blinded the opposite way, that everything that the government is saying is wrong, which maybe that's true
Maybe
with a
that's
lot
more
of things.
true.
But that's why you should do your own evidence and come up with your own conclusions, and just don't live on some guideline that expert opinion. And we know these experts are all appointed because of their influence in the universities and their influence on pharmaceutical companies and device makers, period.
That's what expert is these days,
Yeah.
and it is. But my friend, your ex-student, said gave me a quote by Richard Feynman, who's one of the great physicists of the world. I don't think he's alive anymore. He worked on the Manhattan Project, but he's one of these physicists who writes books that people can understand. But people asked him what the definition of science was, and he said science is not believing experts, and that's definitely the truth of medical.
Yeah,
I mean, if someone says they're an expert, I immediately know they're full of crap, and they're probably saying something, and from their pharmaceutical handlers, and they may not realize it or psychologically think they're saying something good, but they know if they said something the opposite, they're not going to get the next big study that these drug companies are offering, and which is not only money for them and status and prestige for them, but crucial for their university because that's how universities are funded now, with a lot of this drug company money put in to do studies. So all these people on TV, these amazing doctors from Harvard and all these places, and they sound so impressive, they're doing drug company studies and they're going to speak the drug company language. And so amyloid is the new one. We could talk about it in the heart too, because I've seen it damage countless people when they go on medicine for heart amyloid. And by the way, in the rest of the world where they don't use these drugs, they have less dementia and less heart failure
right.
than we
And,
do.
and why? Well, so what is the rest of the world doing? The rest of the world is eating healthy. The rest of the world is exercising. The rest of the world is spending time with their families and socializing. We know about the social interaction in the prevention of Alzheimer's disease. When patients come to me, so what should I do? I say, you know, there are certain things out there that may have a little evidence. Like if you can't hear, you're gonna,
Right.
like get your hearing checked. Like, if you can't hear me talking to you now, you're gonna have a higher incidence because your brain is not gonna function right. And if you can't see, and if you're not talking to people all day, and if you're laying in a chair alone in a nursing home, like what's gonna happen to you? Like your brain is gonna get fried. It's really common sense about some of the things that we need to do. But instead, let's spend a drug that's like $70,000 a year and another like 50,000 to study the side effects that go along with it that may kill you from bleeding into your brain.
Yeah, and let's make it clear, Alan, PET scan or not, there's no way to diagnose dementia.
Mm,
A lot of people who seem like they're going to have dementia don't. A lot of people who have a family history never have dementia. And like you say, we know what they do in the rest of the world where they don't get dementia. There was a UCLA study a while ago that was not sponsored by drug companies that looked at various interventions. And they had people on and off medicine. And the first thing they found, and this is over a year only, these are people with mild memory issues all the way up to full-blown dementia. First thing they found, none of the drugs made a bit of difference. That was their first conclusion. And you won't see this study talked about a lot because of that conclusion. But then it looked at various interventions. And what it found made a huge difference, stabilizing people, was a diet that was low in sugar and white flour and fried food and processed food and high in fruits, vegetables, and fiber. Number two, sleep, people who slept well. Number three was socialization, like you said, having some interactions that were meaningful. You don't have to have a lot, but meaningful interactions. Number four was stress reduction, and they did some form of meditation. And then finally, physical activity. And honestly, physical activity was not necessarily going to a gym or
mm,
doing anything. It was just moving around. It was being mobile much of the day.
mm.
Those
So,
made that was it. But nobody wants to hear that, Alan. They want the amyloid test because it's there. They want to go on these
so
drugs. They want the scans. They want to see the experts, all this stuff.
So we know a simple thing like telling your elderly to do things like resistance training and Tai Chi, where the areas in the world where they do Tai Chi, they have less dementia. Therefore, there's a direct correlation. It must be just like your Subaru story.
Right.
So, you know, we we know that's the case. And when people do that, what happens? They fall less. What happens when they fall less? They have more social interaction because they're not in the hospital having and rehab and getting surgeries and doing all these things and having bleeds in their brain that are screwing up their brains. What are they doing? They're having social interaction, they're exercising, they're doing the things that people need to do. So to me, like that's the key to the care of our elderly in this country. And nobody gets paid to do it. Nobody gets paid to promote wellness and health. No one gets paid to promote good exercise, movement therapies, resistance and balance training, anti-inflammatory diets, and the things that really do make a difference because there's no money in it. You know,
No, no money. There's
fast
no
fast
glamour
food
either.
fast food isn't in there, It's like
Well, it's the glamour thing too. These people who promise the world. I there's a neurologist in town who I specifically talk about in our book, but One of my patients recently, her mom is getting a little confused and we're working on it. And she says, I heard this neurologist is really thorough and caring. I wrote back, I said, thorough and caring basically means she's going to do tens of thousands of dollars of testing and put your mom on a ton of drugs. I said, that's what thorough and caring means. I said, but I get it. What I'm doing is slow. And we're figuring it out methodically. And we're also talking about how to fix it without drugs, but with lifestyle changes, which is what we know. And to them, this is like in this world of fast food, like you mentioned, no, I want answers right now. And these doctors will do all these tests right away and give me all these answers and be very sure of themselves and got drugs. And that seems to be what a lot of people want. And it's not good. I mean, we know too, you want to talk about a paradox. There's a big study, and I talk about it in my newsletter I just put out of it's a 20-year cohort study somewhere in Europe that showed that people who eat more fat, including animal fat, had a significant reduction in dementia. And
Hmm.
interestingly, too, people who go on these statin cholesterol medicines have brain problems. And there's another study that shows that people with dementia on these drugs do really badly. So getting rid of fat is probably a problem. We're all about, like you say, we're very binary. In this country, we're either for something or against something. There's no subtlety. Well,
Exactly.
a good diet probably has some fat in it, but in this country, it's like, oh, we got to avoid all that, or this is all we're going to eat. It's not. It's a good, balanced, reasonable diet, and with a lot of fruits and vegetables and fiber, which we know are good, and we need fat too. But it's just, this fad stuff is just killing everyone, and
Yeah.
we're becoming now dementia is one of the most prominent diseases we see. And honestly, if you ask me from everything I've read and everything I've seen, it's a disease of lifestyle. That's all it is.
I agree with you 100%. We need to change our thinking in this country. We need to go back to basics. We need to go back to primary care, prevention, good diets, exercise programs, socializations like they do in the blue zones. It's not all about the medicine and things like that. And there's that's proof there. The proof is people are living longer. Like, why do people live longer in certain places without disability and debility and dementia? Why? It's
Yeah.
clear.
hmm It's clear, and they don't see doctors, and they don't see
Yeah.
experts, and they
They
don't get PET
especially don't see
scans.
specialists.
They do not see specialists. If anything, they'll see the primary care person who comes by once in a while to make sure their blood pressure is okay. But they're not gonna, they don't know their cholesterol ratios and all that stuff. It is kind of it's kind of easy when you think about it, but
It
you
is.
have to be able to not be glitzy. That's the crucial thing, and
Yeah.
not buy all this
And,
stuff.
and the young doctors just don't believe in the common sense of medicine anymore. It's there's an app for that. Let's just put it in the app.
Yeah, there's my percentage here. Well, if you take this drug, you're going to have 17.2% lower risk of this or that. I ask, where'd that number come from? Well, it's in the app. There's, a lot of good studies. And, it's not like these new, I'm sure we're going to have we just had a hypertension guidelines and cholesterol
Cholesterol
guidelines.
guidelines. Yep.
But now we're going to have a dementia guideline. It's bound to come out from these experts, and they're going to recycle old observational pharmaceutical studies like they did with the other two guidelines and tell you got to start screening for dementia at 10 years old and screen for amyloid at 10 years old. And if it comes, get on these drugs immediately. So, and then when you get the brain bleeds, hey, that's good for the healthcare system. So it's a win-win for everyone except for the people who put their trust in a system that is actually not interested in them at all, other than their wallet. And
So the
that's
folks on the call, the moral of today is don't get tested for things that you can't do anything about anyway. Don't overtest. Don't overtreat. Your health is really mostly in your hands. Doctors only make about a 10% difference in people's longevity. It's just you're doing too much to yourself, and most of the things we do to people hurt them. We don't do it for them, we do it to them. So do things for yourself. Eat healthy, exercise, prevent yourself from falling, have good family socialization and relationships, and you're less likely to get dementia. And don't take some of these silly drugs that are not going to help you anyway.
And that is the lesson. And it's pretty much the lesson of all our talks, right? So it's pretty easy. Okay, Alan, we'll have a good rest of the Sunday.
You too. Take care.
Okay, bye.
Bye bye, everyone.